I'm Dr. Kristin Wheeler. I'm an obstetrician gynecologist, and I practice with SSM Health Medical Group. I completed medical school at the University of Tennessee in Memphis and residency at Barnes-Jewish Hospital. As an obstetrician gynecologist, I see a variety of patients, starting with adolescents who are coming in for their first gynecologic exam or any complaints they may have. I often see young, healthy women for their preventive screenings. I see reproductive age women for prenatal care, and the continuity of care continues into the menopausal age range as we move into treating new issues. When it comes to gynecologic exams, many women and young girls have a lot of anxiety about that. They often dread that visit. And so I find it's helpful to first explain what I'm going to be doing, all of the different parts of the exam, and why I'm doing that, because it takes some of the mystery away from it. And so if people understand why I am doing it, they relax quite a bit more. I think that there are so many things about our health that we're not often in control of, but to go to your physician once a year and have your breast exam and your pelvic exam and any indicated mammograms or pap smears is such a simple thing to do, and we can prevent so many things that way that our breast cancer and cervical cancer are entirely preventable. Such an easy thing to do. And that annual visit is often so important as well, because when you go to the gynecologist, you're going to be asked questions about your sexual health, your periods, things that none of your other physicians are going to ask you. So if you're not going in once a year for that, there may be quality of life issues that are going undetected. I like to be as accessible as I can be. If a patient calls in with questions or concerns, I like to answer things by the end of the day. I never like to leave that unfinished. I know a lot of people have anxiety if they're having bleeding issues, and so I like to resolve that as quickly as possible. I really enjoy using my chart to message back and forth with patients. It often allows them to talk to me directly about things they might not want to relay to someone over the phone, like a medical assistant or a scheduler. I really appreciate the accessibility that SSM gives to patients. There are a variety of specialists and subspecialists and imaging and testing centers that are at a patient's fingertips and all within the same system, so it's very streamlined, and I appreciate being a part of that.